Hello, and welcome to Train as a Health Self-Advocate to Become a Health Collaborator. I'm Stacia Denhart, Development Associate at the Center for African American Health. Just some technical housekeeping. In this webinar, you are muted and will only see the presenter and her slides. You can find the chat box down at the bottom of your Zoom screen. If you select all panelists, you can type in any question about technical issues. And you can also chat to everyone in the group by selecting all panelists and attendees. Also, just a side note, our presenter can't see your smiling faces, so feel free to show her some love in the chat during the session. Throughout our session, please post questions in the Q&A box, and our presenter will answer as many of those as she can. Our presenter today is Dr. Jennifer Warren, Executive Director of the Center for African American Health Disparities, Education, and Research. Dr. Warren, I'll hand things over to you.
Thank you. Thank you very much. I'm glad to be here today for this workshop, which of course, I think it's a very important workshop. And I'm just going to get started because we've got a lot of ground to cover in this lecture and presentation and workshop today. So let me just get my slides up. Give me a second. Give me 1 second. It's not showing my screen. Give me a second. I'm trying to show my screen. It's bringing up a wrong PowerPoint that's not even open. Oh, here we go. All right. Here we go. So, train as a health self-advocate. Become a healthcare collaborator. The reason why I decided to propose this workshop for the 2021 Black Summit Conference is because of the systemic inequities really that Black women face. This workshop is targeting Black women because I know that usually in families, Black women have the responsibility for the care of their children, and sometimes as well as their partners, significant others, spouses. And it's important to understand some of the background of that advocacy, and why do we have to advocate? What are some of the conditions that create that need for us to become self-advocates? So today we're going to talk about systemic racism in healthcare, how systemic racism affects medical care, health provider implicit and explicit bias, and then we'll talk about what is health self-advocacy, and effective health consumer advocacy, and then effective strategies in advocating for your health. So we all know that just based on our society right now with all the demonstrations and the talk that there is systemic racism in America, and as such, as a social institution in America, there's systemic racism in healthcare. And it has major dimensions of racism. And in healthcare, it's this dominant racial hierarchy that is representative, with dominant groups being in more power and non-dominant groups or minoritized groups having less power. Individual and collective discrimination, that is provider, individual bias toward the client, and then collective discrimination overall. And then the social reproduction of racial material inequalities, and that is in access to healthcare and health information and health education. And these are socially reproduced in a way that undermine the health of minoritized groups. And then racist institutions are integral to the white domination of Americans of color. So these institutions really prop up racism in our society and reproduce, maintain, perpetuate the inequities that are faced by Black women in healthcare. So, systemic racism in healthcare. I mean, clearly, it has never been equal for Black Americans in this society. And the white elite, those in power, play a central role in maintaining this. because they want to create the conditions for the maintenance of white privilege. And approximately 20 generations of whites inherited social economic resources from ancestors such as African American, Black Americans, who benefited unjustly. So that's where the wealth gap and resource gap really began to be perpetuated. And to the present, Americans of color are economically impoverished and unhealthy due to this lack of access, because white Americans have long used extensive discrimination and resistance to ensure that as a group they are economically much better off and generally healthier. So systemic racism in healthcare, significant data, and that's research data, suggests that many white healthcare personnel maintain pro-right and other anti-racial beliefs. These beliefs include normalized notions of stereotypes that represent various groups, like Black women, for instance. There's stereotypes that really cross us in regards to our gender. We're caught with that stereotype of needing to fill that socially constructed role of performing femininity the way it's supposed to be performed, or the way society believes it's to be performed. And then we have Black, African American as another, as a minoritized group, and the social types that go along with that, being inferior, unworthy, stupid, unintelligent. That's layered on to the gender discrimination. And then if class is involved in it, if we're looking at lower income Black women, we're looking at stereotypes that relate to low education, low literacy, not understanding things. So Black women are really at the intersection of oppressions when it comes to race, class, and gender within healthcare. It's a triple threat on Black women as they seek medical care. And there are normalized notions of biologically and culturally distinct racial groups. And these normalized notions, unfortunately, link with practices that are not really appropriate and display discrimination toward people of color. And they account for and contribute to institutionalized inequities in healthcare. So systemic racism affects medical care. Provider-patient relationships that are racialized affect the health of population. So that being white providers with people of color. And they affect it because mostly white provider treatment decisions about women of color are shaped by the power that these providers maintain from gender and racial, and I'm going to say class hierarchies in society. And many provider and consumer or client relationships, especially those with patients of color, consumer of colors, are shaped by societal power imbalances. And what that means is when you go into a healthcare system, there is, unfortunately, for many people, many providers, an unfortunate stigma, that an unfortunate worldview of minoritized groups that that really is embedded within the system of healthcare, and that is supported and propped up again by the way in which power imbalances are within patient, or I should say consumer, health consumer and provider relationships. So some of the effects as well are Black women are less likely to get breast cancer, but when they do, they are more than likely to die from it, and they die at a disproportionately than whites. Black women with white physicians are often don't have enough information and may not know about preventive care and are not screened as much. And unfortunately, they are not referred to state-of-the-art treatments by white physicians. White women are, but Black women are not. And as a result, and this is state-of-the-art treatment and cancer care, and as a result, the death rates, the sickness and death rates associated with breast cancer are unjust due to the distribution of healthcare resources by providing state-of-the-art treatment for some and not others, and from generations of systemic racism. Study findings also indicate that African Americans are less likely to receive pharmacological therapy, that is, given medicine, diagnostic, angiography, and catheterization, and invasive surgical treatments for heart disease and stroke relative to white Americans. So we sort of fall by the wayside when it comes to cardiovascular treatment, where whites are giving better treatment and better outcomes. Blacks are less likely to be recommended for standard catheterization as compared to whites. And another study found that Black patients with lung cancer were less likely to receive the best treatment and compared to white patients. Black patients are less likely to receive transplants than whites. And I'm going through all this. You can see how really intense this is. The reasons suggested by one group of researchers included physicians' unconscious bias and financial disincentives. So finances play a role in how they treat us in healthcare settings, or treat Black women in healthcare settings. Another study found that Black patients with end-stage renal disease who wanted transplants, but there were it was a large difference in the amount of Blacks who were able to obtain transplants compared to whites. Whites were being referred more often. And implied or explicit in this research is this need to want to blame Black patients for being too passive, and white patients as seen as more actively seeking what they need to make their health better. So they make it about the individual and their health behavior instead of looking at the larger social inequities and how that plays out in provider-patient relations in healthcare. Black Medicare health consumers with more circulatory problems were much more likely to have their legs amputated than otherwise comparable whites. And Blacks with prostate cancer were more likely than others to have their testicles removed. And this is not more likely because they were more likely to be sicker. It is just that these play into racism and racist stereotypes, and it affects diagnosis and treatment. So these are why legs are amputated and testicles are removed in much greater numbers than whites. Black patients have problems comparable to whites. Black patients have problems with getting fewer tests and less sophisticated and no hard treatments. And I want to say that this disparities, these inequities in heart health are important because Black women suffer disproportionately from cardiovascular related deaths and cardiovascular related chronic diseases, hypertension, and then stroke. We suffer disproportionately from other racial and ethnic groups. And as well, we suffer disproportionately from the risk factors that contribute to cardiovascular health, and that is obesity as one. And so it's interesting that there would be such a lack of attention to cardiovascular health among Blacks, and in particularly women. Let's see here. Black consumers are less likely to be recommended for mammography screening, influenza immunization for older patients, and smoking cessation programs. Now, influenza immunization, I'm not talking about COVID-19 vaccination. I'm talking about just the regular flu vaccine you get every year. And these physicians often fail to recommend breast treatments and seem to be influenced by the health behaviors of patients. So instead of really looking at what the symptoms are and what a possible diagnosis is, it seems like with Black women and other minoritized patients that the white health providers are more concerned with what are you actually doing, which again puts the onus and responsibility on the person and the person as the fault for the disease or illness, which is highly problematic. A study of emergency room care found that Black children with sickle cell anemia got less attention to pain than whites. And we all know that sickle cell anemia is a horrible disease which causes horrible pain. But there's discrimination there. One overview study found patients of colors were more likely than whites to have their pain taken too lightly, and less likely to have it medically recorded, which is unusual because all diagnoses and whatever the physician feels is necessary for diagnosis or for the health issue is to be documented in the electronic health record, but they don't. And when it comes to pain, unfortunately, Black women and men are less likely to get quality pain management. And again, this is due to systemic racism and health provider discrimination. And let me move this. So growing research literature indicates that many healthcare providers harbor implicit bias and also more overt racial perspectives that shape their perceptions of patients of colors. One study found that white physicians tend to view Blacks and those with low income less favorably than white patients and those with higher incomes. White patients are viewed more intelligent and likely to follow professional advice. Research also shows that many white physicians automatically assume Black women lack the drive to follow medical instructions or the income necessary to afford medication. Another study found with white doctors and nurses how they explain racial inequities. Here we go. They go back to blaming Black patients for being passive and failing to make medical requests of practitioners. And that's like a double bind there, because if you don't have the wherewithal to gather information in order to create questions and know what treatments are available, then you're really going to be in a precarious situation when it comes to your health care. Rarely are practitioners' discrimination used in explaining inequities in care. It is usually about Black patient behavior. So becoming informed about your health issues and how to deal with it becomes even more important. Researchers have found that white physicians who accept consciously or unconsciously racial stereotypes are likely to communicate this in their nonverbal and verbal treatment behavior with Black clients. Sometimes it causes Black women to withhold discussing certain health issues that are necessary for treatment due to their perceptions of discrimination from providers. And while racial concordance, that means a Black provider, a Black patient, is preferable among Blacks, many Blacks, it's difficult to find Black physicians sometimes in predominantly white healthcare systems. And given African Americans' personal and collective history of experiencing medical racism, many Black women feel uncomfortable expressing medical concerns to professionals who are disproportionately white men. And this all comes from the literature over the years, and it is really becoming quite clear through more and more research that is being conducted that these systemic inequities are really linked with the health of African Americans. So the outcome of systemic racism and bias, added stress. African Americans already suffer from stress due to racism in society and racist discrimination. We carry something, or we are referred in a way to having a allostatic load, which is a stress load that burdens us in such a way that it causes ill health. So this is added stress that is instrumental in diminishing our quality of health. And distrust of healthcare practitioners is an outcome of discrimination, delays in seeking medical care and returning for follow-ups, which is problematic because many times we need to seek medical care for important issues, and we need to return for follow-ups to ensure that something has been taken care of. But the way in which healthcare inequities have rolled out, it has put African American women in such a state where there are barriers to seeking care. And of course, our morbidity and mortality rates are the effect on our disease status, and death rates are linked with institutionalized discriminatory medical practices. So what is self-efficacy? If we're looking, after all that discussion about all the inequities that impact Black women and Black men or Blacks overall, it is important to understand what is self-advocacy. Because when you walk into an appointment and you are facing sort of the situation as presented, as just presented, there needs to be a sense of empowerment and a sense of, I have the capacity to deal with this interaction in an effective way. So self-efficacy is about taking responsibility for your life, and in health, it's about taking responsibility for your health and knowing your health rights, which are always spelled out within any insurance booklet or any insurance site that you may have. Medicare, Medicaid, any HMO, they have the rights and responsibilities of the clients / patients and of providers. So know your rights. Learning to ask questions until you know what is happening. This takes guts, because it means probing and asking a provider in a situation with a power imbalance to further explain things which may not sit well with a Black woman patient in with the provider. They may not be assertive in that way. So it's important to figure out how to ask these questions regardless of your personality type. Learning to solve problems, and that's being sort of quick on your feet if you are involved with a racist provider. How can that challenge be addressed in a way that still you walk out of there feeling like you were treated for what you had and you feel comfortable with the diagnosis? Speaking and acting for yourself and others about your care. So you speak for others too. And as a Black woman and you have children and or a spouse, being able to speak and act for them as well. Deciding what is best. That means being informed. You can't decide on the best medical treatments or make health decisions without adequate information. And not only taking responsibility and knowing your rights, but when you're in a situation where you feel your rights are being dismantled or sort of diminished, standing up for them. And that means knowing what your rights are. You are a self-advocate, and you may already have these traits. If you've ever spoken up for what you believe in, you have taken responsibility for your life in some way, you have ever questioned people's expectations of you. So, health self-advocacy. It is the responsibility of your healthcare provider to provide appropriate care, and it's not yours to educate healthcare providers. And the only example that I can know of this about educating your healthcare providers really comes from the treatment of individuals who identify as transgender. Many physicians don't even understand what that means for the individual, for their health, and if a transgender person can get an appointment, if they can get an appointment, they have to teach physicians who are open to being taught about how to care for their health. But in any case, transgender or Black woman, it is not your responsibility to educate your healthcare provider. As a client, consumer, you can offer resources based on your information gathering and other information that you may have that you can provide the physician, and you can insist on competent care and being provided that care respectfully. Self-advocacy is a client's ability to represent one's interests. So if you are managing a disease, then you're able to manage that disease because you've done your self-advocacy work. And that's what we're going to get into in the workshop. How do you do this? Self-advocacy increases the ability to seek, evaluate, and use information in patient provider situations. And self-advocacy is a set of strategies you can use to get the treatment you deserve from your healthcare providers. So health self-advocacy is important. And it's about empowering. And that's overall giving you the power, authority, and control over treatment, and equipping yourselves to ask the questions and assert yourself on your own behalf. And that is seen as empowerment. I see it as increasing your capacity to do those things. So effective health consumer self-advocacy. Information increases individuals' assertiveness. So research. You have to know what the information is in order to feel as though you have a platform to stand on. And it can affirm your own worth and help build your assertiveness and increase your willingness to ask questions and to challenge the provider's authority. And it enhances your ability to participate or collaborate in treatment decision making, which is important. We do not want to be passive people sitting in a physician's office with them just giving us information and we just take it. Because as we can see, based on what I've showed you about the inequities in healthcare, that sometimes the treatment and diagnosis is based on racist stereotypes and worldviews that are not favorable to Black women. So greater knowledge and assertiveness leads to mindful health decision making. And that's the opposite of being passive. Mindful means you're in the moment and you're active. Health advocacy increases satisfaction in healthcare. So learning to become a self-advocate will provide a better situation for you in engaging your health provider and health systems, and even your insurance, because insurance is also a part of being a self-advocate, understanding what is available to you under your insurance. Once you know everything that you have that is offered to you through your insurance, and being able to activate what is supposed to be provided to you, and with that increased capacity of information that you have, those three things seem to increase satisfaction in healthcare. And studies also show that empowerment is associated with several key outcomes just personally: increased self-esteem, self-efficacy, confidence, and optimism for the future, as well as greater treatment retention. That means staying in treatment, and again, satisfaction. So health self-advocacy has some really nice outcomes in practice and for the individual. And it also allows you to maximize your time with the practitioner. It allows you to be well prepared for an appointment, to maximize that time. And being informed, having information ready, means that you can help expedite, move forward the diagnostic process, and give providers the maximum possible time to practice whatever therapy or treatment they're going to practice. So self-advocacy is so important for Black women's health. And so we have some strategies here. These are some. Educating yourself about a particular health concern. That is, having increased information about your illness and recommended treatments. And that enables you to engage in successful mutual exchanges with healthcare providers about healthcare. Thinking about what type of treatment you would like. And that would come from your research based on the condition you are looking into. Writing down and noting those options. Asking questions about your care of a particular health issue. Waiting until you've heard all the information you need to make an informed choice and decision. And that may mean more research on your part, asking more information from the physician. It may even mean going to get a second opinion, because even individuals who are on Medicaid and Medicare have the right to seek a second opinion. Providing feedback to service providers on the care you receive. So making sure they know how you felt or how your condition responded to the care you received. So following up, and then using your own strategies, whatever they may be. Because I'm not assuming that the people who are engaged in this lecture don't already have their own strategies to ensure that they're being treated correctly and being diagnosed in a way that is not aligned with race, gender, and class. And then also creating a health self-advocacy plan. That's very important to really owning your self-advocacy, because when you write it down, it becomes real and you have something to strive for and to build on. And that's what will happen in the workshop that follows this. There'll be another little presentation about during, before, and after the appointment, but most of it's going to be really thinking and writing out a health advocacy strategy. So the bottom line, it's your body. There may have been a time back in the day when it made sense, not for Black folks ever though, but when it made sense to put our healthcare providers completely in charge of our health, but that is no longer the case. You should envision yourself as a healthcare consumer instead of a patient. Patient that has no rights. Patient has no rights. Once you're in the hospital, if you're in there for, you can't even leave sometimes when you want to, unless you sneak out. But a patient has no rights. If you re-envision yourself as a healthcare consumer, you are shopping around for providers. You are interviewing providers, and you are finding out the providers that are best going to address your needs and who may be more friendly to you as a person. So we need to be part of the healthcare team. And being part of it is really taking control of how we enter into the healthcare system. That's the first step. We're already in it, but I'm talking about finding other doctors, dealing with issues, addressing problems. So we need to be a part of that healthcare team, and that comes from being effectively prepared. And no matter how amazing your healthcare practitioner is, because I've heard some stories about people who just, oh, he's the best or she's the best. They take care of a whole bunch of bodies in a given day. And I have to tell you, from my own experience, I had an interaction with a physician who I had been working with or had a few appointments with. And we were doing telehealth. And I'm on the end of the line of the phone, thinking that the physician has my records in front of him, that he is doing what he's supposed to do. And for the reason why I was calling is very critical, and it's an issue that is very prevalent in African Americans. And so this physician who I've talked to on a few occasions before, on this one occasion, didn't know whether I was a Black or white person on the phone. He didn't know that his appointment was with a Black woman, and I don't even know if he knew my age. At that time, I believed he had no records in front of him. So when we think about telehealth as well, we need to think about how are we being treated virtually by our physicians, and how does that change how we interact and provide information to our physicians? And is the physician really on the other end of that line, if you're on the phone where you can't see them, are they really engaging your medical records, or are they just home sitting on the couch? So these are issues that are really pertinent when it comes to telehealth, because we can fall through the cracks as well in healthcare as it relates to telehealth, which is what is the main thing nowadays in the pandemic. Providers engaging clients via the phone and via virtual web means. So, but listen, you only have one body. I only have one body, and it's yours. And it runs for a limited amount of time. So do not be afraid. And I think fear is one of the biggest reasons why folks do not do more advocacy for themselves. But do not be afraid to be involved in your own care. As demonstrated by the evidence, Black Americans and Black women are not getting the treatment nor the diagnoses that they need and deserve and to which they have a right. Thank you, and I appreciate any questions you may have. So I'm going to just open it up for questions if anybody wants to talk. We have about 20 minutes for questions. Oops, I didn't
I
mean.
haven't seen any questions come through the Q&A box yet, but we'll give people some time. If they have any, they can post them now.
Or any comments. Maybe it's not about questions. Maybe it's about comments or adding to the discourse about what has happened to you. Share your stories or share a story that may highlight some of the things that we talked about or your concerns. So it's not always about questions for me. It's about just engaging you in conversation about these issues.
Okay, I just saw one question come through from Lisa. Is there some steps that you can take prior to an appointment to be ready?
I will talk in detail about that during the workshop. I'm sorry, I cannot disclose that right now. That's for the workshop. There are steps, and I will outline them. But I have to hold something back because if I give it all now, we might as well just start the workshop right now. Hello? 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 Can you hear me? Hello?
We can hear you.
Oh, everybody froze for a minute. So my question to the organizers is when does the workshop start?
So it's actually, I think it was just booked as one session. So you were booked for 12:30 to 3:30. It's all going to be in this same Zoom webinar. So if you are finished with your presentation, you can just transition right into the workshop.
Yeah, well, I'd like to give the participants at least a 5-minute break. I mean, they sat through me just running my mouth for like almost 40 minutes. And then we're going to go into a 2-hour session, which
Yep.
I will give a break in between. So if panelists need to take a break real quick to get something to drink or do whatever else you need to do, please do. And we'll reconvene in like 3-5 minutes.
Okay. I have 1:09 on my clock, so you want to say let's start at 1:15?
Okay, 1:15. So
Okay.
1:15.
All right. See you back here then. Thank you.
Okay. Hi, everybody. I'm back. We've got about 1 minute before I start the workshop. All right, so let's get started with the second half of this presentation. The first half, of course, was a lecture just laying out the systemic inequities, the provider-client challenges, as well as why it is important that Black women really cultivate the skills required to be health self-advocates. And so I'm going to share my screen again because the question the other person had in the last session, I'm going to address it now. And this is a quick PowerPoint, but before, during, and after the appointment. And this is with a provider, health provider. So, one of the first steps you might do is to research your provider. And if you're looking for a new provider or just trying to find a provider for a specific health issue, you want to look up providers that are in your network. So you can start by looking at the back of your insurance card and calling up for members only to see if they can provide you a list. Sometimes insurance providers have a list of individuals on their site of providers and what insurance or HMOs they take through. And so that's the first place to look. Once you have a listing of providers that take your insurance, because that's the goal, we don't want to pay out of pocket, then you might want to do some internet research. And the internet has made it much easier to get reviews of your physician. So I put ZocDoc on here because this is one location that you can go to. And these slides are up so that you have access to this, where you can get reviews on physicians. Reveal is another website where you can go to get reviews of your physician. And for plus size individuals, Fat Friendly Docs, this is not a joke. There's a lot of obesity stigma among providers, and they get caught up in overweight. If you're overweight, they get caught up in your behaviors as opposed to addressing the issue you might have. And this is just an example of why you might want to find a fat friendly doc. A friend of mine went to see a provider, and she was obese, but she had some back pain because she had just moved into a new apartment, and the back pain came, she thought, due to the workload and the stress of lifting. And she went to the doctor, the physician, to get her back issue addressed, and all the physician could talk about was that she was overweight and she had to eat healthy, and was not addressing her back pain at all until she got assertive and said, I'm not here about losing weight. I'm here about the pain in my back. She said, I was fat all my life. I never had a pain in my back, but I was moving yesterday and now I have a sore back. So can you please help me address the pain in my back? So she got a little assertive. But if you want to find a doctor who is not going to get caught up in all of those questions when you have a real serious health concern, Fat Friendly Docs is the place to get reviews and to find doctors who may be in your network that are friendly for plus size individuals. Sorry about that. And then you can also call the provider's office. And I know many folks have not really done this. And you don't have to give them information about yourself. You get information that's vital to you. You ask them, are they diversity friendly? Maybe. You can ask them, do they perform certain treatments? You can ask them, what type of physicians they have, if they have any African American physicians, any Black women physicians, any type of physician that you feel that you need. You can ask if they have that. You can make a list of the inquiries that are important to you and just ask anonymously over the phone to find out if that provider or that practice or that health system, if it is good for you. So research your situation. As I talked to earlier in the first lecture, it's important to understand whatever disease or illness you may be facing, if that is an issue, that you understand it. So when you make your appointment, if there's certain things that are attached to the situation that are problematic for you, you can ask that that information be given to your provider. Like, for instance, going back to being overweight, if getting on the scale causes a person, maybe they have body dysphoria or some other body issue. Getting on the scale might cause severe psychological distress. You can say you don't want to be weighed. And you can provide other information to your physician, maybe about trauma that you have faced, and that person needs to be aware of this trauma because it sometimes impacts clinical encounters. So you can provide contextual information to be given to your provider. And also looking up your symptoms can give you some idea of what might be going on. Now, I have to say you need to be very careful with this. Number one, self-diagnosing, I do not support, because you can go online and you can have every disease that there is, because some of the symptoms are the same for several different diseases. So you just want to really gain an awareness of what might be possible, what symptoms might be aligned with what you are experiencing. And those looking up symptoms might provide you with questions to ask your provider so you can dig in deeper to the situation. And then if you're researching this, for instance, if you have diabetes, type 2 diabetes or type 1, you can look up general diagnoses, and you can look up what treatments are provided, so that you go in there with some knowledge of what the standard treatment is for type 2 diabetes, what medications are distributed, and also what are the side effects of some medications. So being a self-advocate, again, is not a passive information come to you thing. It's about you actively being engaged and getting this information. And this can be very helpful if you fear that your provider might inappropriately dismiss your symptoms. Sometimes a little pressure can get you the test you need, regardless of practitioner biases, or address any other issues that might get in the way of your care. I mean, if you're feeling very assertive, you might say, you know, research, I've read research that has demonstrated that Blacks normally are not given the correct treatment for blah, 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 blah. And you're putting your physician on notice already that you already understand that there are inequities occurring within this particular chronic disease and for Black Americans. That's if you're feeling assertive. So there's communication strategies you can utilize, but it's important for you to press back a little if you realize that there are state-of-the-art treatments that the physician has not provided to you, and you want to know why, or you need to really assess the depth of his bias and discrimination by sharing the facts of how there are inequities in treatment in this area for Black Americans. Making the appointment. We already said you want to make sure the physician has contextualized information, and I want to make it a point that is important. If you feel there are issues that can interfere or cause a challenge to your interaction or your ability to receive treatment at that facility for some reason, you need to share this with the health provider. So making the appointment. Again, we're not talking about passive. This is action. Self-advocacy is action. Make an action plan for the appointment. I only remember It's been 16 years now, but when I used to go and take my infant to see the doctor for well visits or any other visit, I would always go with questions and research that I may or may not provide, but at least it gives me insight that I can base my questions off of. But I would write down what I want to get out of the session, the symptoms my child was having, what concerns I need addressed, and the questions that I need to have answered so that I am comfortable with moving forward. And you might have numbers for your doctor. This may include if you're monitoring your glucose levels. I know some patients have to monitor the high blood pressure daily and provide that information to the provider. So having documented information, and there are many apps. I have an app on my phone where I can put in health information and numbers so that when I go to the physician, I can supply the physician with this information. And there are a lot of applications, mobile applications, that help you track your health. And that might be one way, if you have a smartphone, to go about capturing these numbers. So numbers are important to physicians, you know, blood pressure numbers, glucose numbers. I mean, they really are. So to have them and to show a pattern about the numbers is really important in establishing really effective treatment and in dealing with any issues that may come up when your numbers go high. And so print out what you research or save it on your phone. So when you have it, you can bring it up. Or bring up a piece of paper that you wrote things down on, the research, jot down some notes. But you want to go to the physicians equipped. And again, this is for Black women and Black men, but this is targeting Black women. And I'm saying this again based on the breadth and depth of health inequities and provider-client discrimination that occurs. You have to be prepared for your appointments. Choosing your approach and overcoming bias. Now, the next slide, I think, talks about personality characteristics. If you perceive in any way that you are being discriminated against, you're going to have to decide how to deal with it. The first thing that I think is important is really making your health the priority, regardless of what the person is doing, because they can be discriminating, but they can be providing decent care. You know, juxtapose those things, don't go together, but the ultimate goal is whatever you went to the physician for, whatever that issue is, you want it to be fixed. So sometimes you may overlook that discriminatory interaction and choose to deal with it by next time going to a different doctor, making a whole different choice. But for the moment, you may just need to deal with it because you need to get the situation handled. But again, it relies on your personality, and we'll get into the next slide. Because ultimately, doctors are in authority, and they can refuse to treat you. If you are a bit out of pocket and perhaps getting angry, being aggressive, and many times they see Blacks as being aggressive when we're not, or being bodacious as Black women when we're not. So we can even question that refusal to treat if you were really behaving in that way, or if this person's bias just cast you in that role as being disruptive and bodacious or aggressive because of your race and your gender. The best case scenario, though, is you want to work with a team, as a team with your physician. That's very important. To have that exchange, that interaction, and teams share information. That sharing, that exchange is going to be helpful for you because it will definitely provide you with greater breadth of information to deal with your situation if you can apply this team approach, this collaborative approach to your health. And healthcare providers, as I said, have a lot of authority. And if you start speaking up for yourself, or and you're equipped with some basic information that is not a diagnosis, but it just shows you have an understanding, if you present this information, there are many physicians who will dismiss the information because you got it off the web. or dismiss you as the individual giving the information because of whatever bias they may hold about you or your social identity. Remember, being unintelligent for low income Black women, not following through on medical treatment, some of their perceptions. So, these biases come in and play a big role. But the bottom line is there has to be a sort of balance between applying the pressure, speaking up, and getting your health needs addressed. At your appointment, you have the right to decline any procedure. Of course, they're going to make you sign that you refused it, but you can refuse it. The refusal should not be on feelings. The refusal should not be based on the fact that you think your provider is racist. To decline a procedure should mean that you have researched it thoroughly and you have gotten all of the pros and cons, the ins and outs, the ups and downs about this procedure, and you're talking with your doctor more about it and the side effects and outcomes. And once again, having all the information, you can make an effective health decision. And if you want to decline a procedure because you have done your homework and working with your provider as a team, you can choose to decline. State your case. Be clear about what you want. I'm here because of. And it's one thing, not two. Because if you have two issues, you have to come back for the second issue because they can only put in one issue for the appointment. That's based on my experience. So it's one thing and give it to them. Avoid being defensive, although that is hard sometimes if you're dealing with a provider who is sort of egregious in their discrimination. But try to avoid defensiveness. And again, the whole diagnosing self falls on deaf ears. So all you really want to do is focus on your symptoms. Be clear about your symptoms. Be clear about when it happened, the date it occurred, how long it's been occurring, what it feels like. Just be clear about all those things. Give the symptoms. That is very important. And keep your practitioner focused. As I said before, some practitioners, when working with overweight people, get all caught up in the healthy eating, losing weight thing, and forget that that person came there with a health issue. If you need to refocus your provider because they're getting off into the weeds, then you refocus that person. You let that provider know, excuse me, Dr. Hahn, I'm here because of this, and it's causing me a great deal of pain or discomfort. And get them back into focus on the health issue for which you made the appointment for. Reflections on provider bias. You got to really characterize your own personality and confrontation style. Sometimes you got to go there, but you need to go in there, picking your battles judiciously. If you walk out or are thrown out, how much will your health suffer while you find another doctor to get another appointment? And if you do find another doctor quickly, what are the chances it will not happen again? So if you have time on your hands, you can do the review, look up the reviews of the provider to maybe ensure that it won't happen again. If the reviews are positive, right, call up the office to see what type of practice it is. Maybe that can give you some information to help you make a decision. But you have to really ascertain, is it worth whatever is happening? Is it worth losing that appointment? Will your health be in jeopardy if you are too confrontational and you walk out or get thrown out? And as I said before, practitioners can lash out at patients who come prepared for an appointment or who advocate for themselves. Because remember, you're a patient. You don't have any rights. You're not supposed to know anything, really. So who are you to tell me, after I've had all these many years as a medical doctor and medical school and residency, about blah, 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 blah. But you have a right to share information with your provider and to advocate for yourself. And subtly let them know you know the game. So That's what I was saying. That wasn't subtle in my last example when I talked about letting the physician know that you've read some research. But I guess that could be subtle, that you read some research that blacks usually don't get treated for blah, 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 and it causes this particular outcome. Subtle ways to drop hints that you understand that there are inequities in healthcare, and that you understand the outcomes of those inequities very well. Educate yourself and receive education. So when your physician starts telling you about something, if they do, then listen to what they have to say, because that is working collaboratively in a team way. So educate yourself with outside knowledge, or if they have resources at the provider's office or practice or in the health system that can help you become more educated. Attend classes about the health issue that you're dealing with. They have health education classes in many communities that can give you a good background into the disease area or the illness that you're facing. Get that education. Get it from your physician, get it from whatever resource you can. Because again, as I said before, you only have one body and we're only given it for a limited amount of time. So the more you know, the more able you are to participate in dealing with this health issue. And know what you want, what type of practice you want, what type of health provider you're looking for, what your needs are. If you don't know what your needs are, your health needs are, if you haven't looked up treatments, if you are not doing any of that stuff, you may not know what you want. It may take a little research. And if you don't know how to research, there are resources like WebMD, which I kind of like a great deal, WebMD. It's gotten better over the years. And they provide a lot of good information. They even provide information on how to be a self-advocate for your health. But do the health research. And the thing about researching online is you have to remember, who is the source? Where is this information coming from? Is it a commercial page, a .com? I don't think you want to go to a .com for information about yourself unless it's reputable. Does it have any credits or credited by any outside organization that provides them the credibility to give this information? Who's writing it? Is it a physician that's writing it, or is it someone else? And would that make a difference? Because nurses and other healthcare providers can write this information and it still be valid. But who is the source? And is it current? Is this information up to date? If it's from 2010, you may not want to utilize that resource and may want to find one that may be more timely. Right? So you have to look at your online health resources with an eye of skepticism. But if you go to reputable sites, and I should have made a list of them, and I thought I did, but obviously I did not. Once you have reputable sites, then you know where to go to get your information. So yeah. So know what you want, educate and receive education. Very important. After the appointment, did you know that you can review your chart? You can. Physicians and everybody else act like it's a big secret. You can review the comments in your chart. Maybe you can't get something removed, especially if they wrote something negative about you, if you want it off of there. But you have the right to add notes. And again, you need to really look at the rights and responsibilities that are outlined by your insurance carrier and maybe by that practice. But you have the right to review your own charts and to add to your charts. If you feel your doctor may have left biased notes, you can ask to see the chart. If you know that it was a contentious interaction, and you can demand that a note that explains what happened be added, so that it's just not you being seen as aggressive and confrontational, but there may be a reason that moved you to that state during that interaction. And HIPAA, the Health Insurance Portability and Accountability Act, gives you the right to obtain copies of your own medical records within 30 days. And most physician offices are accustomed to getting these requests. So you can get copies of your own medical records within 30 days of your request. So, and I think it's important to know what your medical records state. It was important for me I have a chronic condition, and I was sort of blown away by the fact that I had it. And I wanted to know if my prior doctor, in their lab work, if they noted anything that might suggest this issue could be on the horizon. And when I got those health records, I could see very clearly that that health issue that I have was already brewing, but that physician did not bring it to my attention. So getting information from your health records can help you ascertain your own health status. If you look up some of the things, I looked up the codes online. They had codes for all the labs. I looked up the codes online to understand what they were in reference to, and the numbers. What's the range that it should be in? And some of these ranges are different for black and white individuals because there are some genetic differences, right? So for chronic kidney disease, it's a different range, I think, than it is for whites. Because
Dr. Warren, I'm sorry to interrupt you. This is great content. I just saw a couple of questions come through the Q&A. Would you like to answer those now while they're kind of relevant, or do you want to hold off?
No, go ahead.
Okay, so one question that came through from Johnny Johnson says, how can we tell the difference between conscious versus unconscious biases by healthcare providers, i.e. negative attitudes about a particular racial group?
I don't know if you could tell the difference between what's going on in somebody's head, if it's conscious or unconscious. I mean, the only reason why we know about unconscious bias, implicit bias, is because there is a well-established test online that evaluates physicians' preference for various races. And so that's how we know that maybe that unconscious or implicit bias may work. But if I was going to say something was conscious, maybe if a physician out and out called you a negative name, then they're consciously making it known that they are racist or they are prejudiced. So maybe conscious is the actual act of verbalizing and then displaying nonverbal behavior that supports their the way they are seeing you. So those are the only ways I can think about a conscious, understanding what conscious may be. That they're aware of that, because if they're going to say something that obviously has a discriminatory tinge to it, then they should be aware of that. But then again, I mean, some physicians have those unconscious biases, those implicit biases that slip out. So is that conscious or not? If somebody wants to chime in, please, because this is an area that is dealing with psychology, and I'm not a psychologist. So conscious and unconscious, I may need to have some help from some of the other people in the group who can maybe give some insight into this question. Can anybody else provide some insight into this area? I thought I saw Dr. Richardson here. Is she still here?
I'm not sure. We did have one other question that came in. Well, it's kind of short. She said, many doctors believe patients should never question, just comply and revere them as doctors. And then she asks, what if you do not get your records within 30 days, or if they tell you that you are only entitled to a limited portion of your records?
Well, you need to know your rights. And that's about knowing your insurance providers, what rights they give you. And that's where that comes from. You have to know what your policy says about your access to health records. But HIPAA does outline that you can get those medical records within 30 days. And it's usually within 30 days because I have gotten my own health records, medical records in that way. And I have a whole folder full of them. So I don't know if that's going to be a problem getting your health records. The problem I would see might come if you wanted to review the electronic health record that the doctor left in your file. They may try to act like you don't have the right to see it, but you do. So, there shouldn't be a problem in getting access to your records, to all of them. There may be a fee involved for some. I know sometimes when you ask the physician to, or the providers or the staff to provide all your records, they want to charge you a fee. So you have to be prepared to pay a fee. But most practices will give you access to all your medical records.
That's helpful. Those are the only questions that have come through so far. Keep you posted if there are more.
So my question about the workshop is, the people can't talk to me, right?
Unfortunately, no. Yeah, their video and sound is off.
Yeah. So my
So
impression
they have to
was
type it in.
we'd be engaging to do this advocacy work and this plan. So this is a slide I made because I thought we would be engaging each other in real time. And I apologize for this. I really wanted to discuss what health advocacy strategies you currently used. And we were going to outline the strengths and weaknesses when it comes to healthcare, seeking healthcare, and interacting with providers. What will I learn or work on and improving this year related to my weaknesses as it comes to dealing with your health? How can my strengths, the strengths you already have, help you in collaborating with providers? In what ways can I deal with my perceptions of provider discrimination or racism in my healthcare? We were going to discuss how to strategize that with interaction with everybody. What specific healthcare advocacy strategies are appropriate for you, because some of the ones that I've outlined may not feel comfortable for you. So it's about identifying those that work well or that you think may work well. What do I need to be successful in implementing your self-advocacy strategies? So now that you've identified these strategies, what do you need to be successful in making them work for you in real time? Who can assist me in health self-advocacy, like someone you can take to appointments, especially if you are sick. I know this happens a lot with cancer patients. They need an advocate, a family member or friend to go with them to ensure that they are getting the information that they need and are getting the treatment that they need. And there's a whole handbook on cancer self-advocacy that's out there. And then when will I begin to use these strategies, and how can I maintain my resolve in continuing to do the work to be a health self-advocate? So these are the questions to be answered to really lay out the plan. Because once you identify specific strategies, once you decide on implementation, who can help you, and when you will start, 6, 7, 8, 9 is your self-advocacy plan. And on the other side, I just put down here what some of the things that I've shared about some strategies to develop that plan. So since we cannot engage each other, and I can't imagine people having a full-on discussion in chat answering these questions, are there any questions about this last slide?
So there are a couple more questions that have come in just in the past minute. So Star, this is kind of following up on the question before about the medical records. Star says, one provider said we can only see a portion and are not entitled to all records. Sounds like you are saying that this is up to the insurance agreement?
HIPAA gives you the right to have access to your medical records. HIPAA is a federal law, a federal mandate that says that you have access to all of your medical records. That's a federal law. That's not a state law. States can't change that per state, and practices can't change that per practice, and providers can't change that based on their whims. You have the right. And see, these are the type of things you have to push back on. If they give you that information, you know your HIPAA rights. You say, I have a right to all my medical records, and I have a right to receive them within 30 days. And you don't argue over stuff that you know. That's a federal law. And that's the bottom line. And if they don't comply, then you report them, or you threaten to report them to the American Medical Association, or if they're a business practice, to the Better Business Bureau, or to whatever accrediting agency they may be with, or whatever other professional organization they may be aligned with. You will report them for not allowing you to have access to your records.
That makes sense. That's helpful. Star also asks, how long are providers required to keep your records to be available to you?
Well, they keep them for a long time. I'm thinking 3 years ago when I gave that example regarding my backtracking when this health issue that I have may have began. So my provider that I went to before held those records for 3 years within their system. Now that is something you have to ask the practice about and the insurance carrier about. How long are your medical records supposed to be held by the healthcare system, the HMO, or the practice? Because I'm not sure about those rules and regulations about how long they are supposed to keep them. But again, I went back 3 years and was able to get medical records from my old doctor. So, and that's a question you can ask on the phone when you're trying to find a medical provider. How long do you keep medical records? Can we have access to the medical records according to HIPAA law? Remember, you can anonymously call up the provider and inquire about this stuff to know if it's a provider you want to work with or not. So these are questions you can give right to them.
Johnny Johnson made a comment saying, you're absolutely right. Your medical records belong to you. It is yours. And the doctor's office is just keeping your records. And then he says 7 years. So maybe he's suggesting that that's the requirement. Robin Bruce asks, I have experienced all that you have said to the point that I tend to only see the NP or PA instead of the doc, have to change provider offices about every 5 years, and have even got to the point that I do not let providers know that I am a nurse, because I find that instead of working with me to address my concern, they spend their time trying to prove me wrong. I'm at a loss on how to avoid this problem. Do you have a suggestion?
Wow. And you are the prime collaborator for your healthcare. Not to be able to disclose you're a nurse is problematic because it's part of your professional identity, which impacts how you take care of your health. So that's a shame that you've had that issue, and I'm sorry that has happened to you. I think that some of the strategies of calling up and asking a practice about how they interact with patients who have been or are health practitioners might be an important question to ask before deciding to join a practice or access a provider. Might be part of that. Asking questions about that first, because that's a very important question. I also think that it's hard to jump around to providers every 5 years. So really thinking about what are the strengths that you have that you can really draw on to push back on these physicians as they have obviously been pushing on you. What can you bring to the table to help get them, remember that, refocusing them, get them focused back on the reason why you are there as opposed to challenging you. So some refocusing is important. And are they discriminating against you in any way, shape, or form that is not tied to your nursing status, but could be tied to your ethnicity, race, income level, whatever. So reflecting on if that's part of this situation and trying to push back, because changing every 5 years is not ideal. You got to get your medical records changed. You got to tell the story all over again to the physicians. So it's really looking at the advocacy plan, laying out how you will handle these situations. And it really, there's no formula. There's no place to go to get the exact answer. People just have to understand that whatever their health need is supersedes whatever the doctor's doing, as long as they're giving you adequate care to address that issue. But for you, I think the before the appointment inquiry is very important, and I would say not tell somebody you're a nurse, but I find that offensive, not to be able to tell somebody what you do for a living, especially your physician. So I would tell them, and I would let them know how you've been treated in the past. Any new physician, I would share with them that experience. And that might be some of the contextualization you might give to a new provider. That in the past, this has occurred in my interactions with physicians. And I do not want to be or have the same situation occur again. And let them know this is an issue, so that the physician or provider knows when you come in that you've already been treated in inequitable ways, and that they should practice more patient-centered care with you, as they should be with everybody. But again, that's what I can give you. And I'm no expert in all this. I may have degrees in communication, but it's always about the context and the situation, how one responds. But in your situation, I would definitely recommend the pre-call, anonymous. And then before your doctor's appointment, the contextualization. Let them know what has happened in the past to you. I would definitely recommend those two things and going on with your health care.
Those are great tips. I just saw this comment come in from Dr. Terry Richardson, who says, definitely tell them you are a nurse. Let them know you are still there to benefit from their expertise, but you want to do it in partnership. I think that's a good point. And then another question, going back to the medical records issue. So are the providers required to make their records in accessible format for people with disabilities, like in Braille or digitally to use with JAWS?
It is a federal mandate that you should have health information that is accessible to you. So if you have a disability, it is incumbent upon a practice, especially a health system, to provide you that information. Now, I'm not sure about how the federal law extends to private practices, but hospitals that receive money from the federal government, they have to provide you information. And you know what? I know that this is a problem for people with disabilities. I have a nephew who is blind, and providers will not provide him with information that is accessible to him. He's not totally blind. He has retinosis pigmentosus, so he has partial blindness, but it makes it hard for him to read all the same. He needs high contrast, and they have not given him information in the form which he can take home and put into his computer and read. So yes, they should be providing this information, because how are people with disabilities going to adhere to treatment, going to understand, because they provide now printouts of your visit, and with information and the advice or the care or treatment they've told you to undergo. And so if you can't see that, read that, hold it, that's a problem. So they are supposed to provide it in a way, just like they have people there who speak different languages to deal with people who don't speak English. They have a responsibility to provide you with information that you understand and that is accessible.
That's helpful. It's like Dr. Richardson also wrote, if there are bios on the doctors, this sometimes can give you a few hints about who the doctors are. And then another comment came in from Johnny Johnson, saying you have to be transparent and inclusive as patients. Providers need to be challenged by intellectual and well-informed patients. So just those comments for now. I don't see any other questions so far. But if anyone has any more questions, feel free to post them either in the Q&A or in the chat is fine.
I just want to say, not everybody's intellectual. That's just not their makeup. So I don't know if intelligence or your intellect is a part of this per se. Like, a person who doesn't have a lot of education can become informed about an issue if they get education on it. And they don't have to be some intellectual to be able to use this. They just need to have the courage to share this information with their provider. So I might, I don't know, I might not use the word intellect as part of being a self-advocate. Yeah, intelligence helps, but, you know, or being an intellect may help you more. But there are some people who just don't have that, and verbal education is how they get information, and they provide it. And maybe that intellect may not necessarily be intellect meaning intelligence, but maybe the intellect can relate to the capacity to discern and understand information in order to relay it. Being able to transfer that information into a clinical encounter with your physician might be aligned with intellect. I'm not sure.
That makes sense. Okay. This was just a follow-up from Robin saying, I understand that what Dr. Johnson meant. He is aware of my skills and part of the pushback because of my medical knowledge. So he might have been directing that comment toward Robin's original comment and question. And then she adds, to Black women, clarify, some physicians have a problem with smart Black women.
Well, yeah, because we're supposed to be stupid and inferior. And yes, and they will try to diminish you in the process of your clinical encounter. But it's important for you to maintain that strength and that intelligence and push back, because that's what I've had to do over the years. And I make sure that they know that I study patient-provider interaction. Because they always say, what do you do? I say, I have a PhD in health communication. Oh, really? What's that? Oh, I study patient-provider interaction. And they're like, oh. And then they change the subject and start talking about, why are you here? But it's important to share these things and to let them know that you are going to celebrate and affirm your intelligence in that encounter, regardless of how that physician may feel.
Great. So I'm going to transition things over to my colleague, John Young, who has joined us on the call. He's going to help moderate from this point on. So he'll be checking the chat and the Q&A box for any additional questions, and he'll relay those over to you, Dr. Warren. And thank you so much. It's been a pleasure to be in this session.
Thank you. Yeah. So I'm just looking for the chat to see if I can see the questions.
As of right now, I don't see anything that hasn't been addressed.
Right. Yeah, but I don't know when this other person's supposed to be coming on. We did go through a lot of it, I mean, quite in depth. Thank you, Mr. Young or Dr. Young, for your comments. But I can't close out. But
Well, I'm taking the place of Stacia.
Oh,
yeah.
I wasn't. I didn't know that. I thought she said somebody else, Chris. Okay.
Chris is your tech guy.
Oh, okay.
Star says, what about the concerns that all of these phone apps will share, sell, and overall misuse your personal data?
Well, you got to read their privacy and protection policies, and that's important because you make a good point. You have to know about their policies before you choose a mobile application in which to document your health and upload your records or keep track of your health numbers, glucose, high blood pressure readings, but it's in the mobile apps policies. That's where you'll find that information. Some are reputable, and those are the ones you need to look out for. But you have to read the privacy policies just to make sure. I'm trying to think. The one that I have that works well for me is oh, if I can find it. I got so many apps on this phone. Oh, I check my blood pressure, so I get the BP Health app. They don't sell your information. I read the Privacy Act, and you can also measure other things using the HP app, and you keep track of your medications and other things like that. So again, I use the blood pressure app, but there are others. But I will not. Oh, I'm going to overstate this. You have to read the privacy policies. Because there's no way I can know that about all the mobile apps that are out there regarding that capture our health information.
And they also add, but all the privacy policies are essentially generic.
Well, then, if there is a level of suspicion that cannot be overcome in the use of a mobile app, then I would suggest that you not use it. Or not you, but a person in general, because then that suspicion is going to be there no matter what. And it could be a source of low-key stress for you, wondering if your information is being exchanged and sold. So I would not look toward an app to keep my information, and I may just get a notebook and write my numbers and keep notes on my health in that notebook. And that way nobody else has access to it but you and your provider or your health providers.
We have a question here. What are the final steps for patients in the healthcare venue? Taking notes, take a witness, or have the healthcare provider summarize the visit with disposition of care?
Okay. That was a multi-pronged question.
Okay.
So what is the meat of the question?
What are the final steps for patients in the healthcare venue?
When they say final steps, what does that mean? Final steps. What does final mean?
Mr. Johnson, do you have any additional stuff? Clarifying statements for this question? And somebody else asked, will the presentation sites be shared?
Yes, well, I don't know how the Wahova app works, but on my profile, I put a link to a Google Drive for everybody to have access to these slides, as well as there's a whole extra file there that has health self-advocacy training modules in it that was prepared by Oregon Health Systems. And so people might want to go there and look at those modules, because it goes more into depth regarding medicine and just really advocating, not just in doctor-patient interaction, or healthcare system interaction, but it just talks about all the different dimensions of your care and how to be an advocate for that. So that's another resource for you to go to, and it has worksheets, and it's really easy to read, but it's very helpful even to myself. So that's why I put it up for folks to have access to go deeper into the advocacy in healthcare.
And I'm assuming this is Dr. Terry Richardson, says, make sure that your main objectives and questions have been answered. Getting something in writing with a summary of the encounter after the visit summary.
Yeah, that's important. And I don't know, for some reason, my physicians just seem to give it automatically. I don't know if that happens for everybody, but what Dr. Richardson says is very important to have that. And again, that provides your own source of medical records regarding what has occurred in treatment with a certain provider.
Johnny Johnson added, understand diagnosis, taking meds, follow-up visits. The patient needs to understand disposition of care.
Absolutely. I agree. That's a good point.
And here is a question. Would you be able to point to a specific link or section of HIPAA that supports getting our medical information in accessible format?
I don't know if HIPAA states accessibility, but I can do some research and put it up in the Google Drive. It says accessible medical records for 30 days. It doesn't state that they give you your medical records in a way, if someone has a disability, in a way that is appropriate for that individual's disability. I'm not sure. So that is something I need to look up. And I will look that up. But I just know that HIPAA does have that rule about your medical records within 30 days. So.
Star says, don't see a link to Google Drive on the session page.
Well, I don't know how to, I'm going to have to call up the, get in touch with the summit administrators, because I uploaded everything onto my profile. The links to the Google Docs, there's 3 links. There's an article from our presentation yesterday, and the PowerPoint slides. So I'm just going to have to figure out how maybe the administrators can help me get it into a place where you can see it, because I thought you could have access to that. So I will make sure that information gets into a place where people have access to it.
They wanted to know, can you drop the link to the Google Drive into this chat?
Let me see. Give me a second. How do I? Give me a second. I'm pulling it up. Oh, shoot. This is the link to extra self-advocacy training. And
See that?
this, huh?
I see that.
And the other link is to the workshop. Give me a second. It's to the slides for the PDFs from the workshop. So link to slides. lecture workshop slides. Okay.
And I just clicked on that and it does work.
Oh, absolutely. And that'll be there for as long as necessary.
I love the way you wrapped around and created an answer.
What happened?
I said, I love the way we created an answer. It's done.
Yeah. So I'm trying to get out of this screen share, and I'm freezing up. Okay. Okay. All right. Well, unless there's any other questions, I mean, without really engaging you all in conversation and building these plans in real time, there's not much more I had. Because it was really based on engaging you all in conversation. Because I'm in no way the end all be all for information on health self advocacy. I mean, I've had to learn along the way myself. And it's because I'm a researcher that I'm able to pull up this information and really be able to distill it and share it. But, we all face our own challenges, for which a self-advocacy plan would be helpful for me as well. So I really am sorry that we did not get the opportunity to really engage with each other in a conversation to build these plans. So, but I did enjoy sharing this information, and I enjoyed the questions, and I thank you for your time.
I got one more statement. Star wants to know, would it be okay to follow up with you directly afterwards if they have questions?
Most certainly. I'll put my email in the chat. Well, it's right there. Can you still see my slides?
Yes.
Yeah, there's there's the email and there's the business number. Feel free to use it. I mean, our outreach is different than the Center for African American Health, but our focus is African American health. We just do it a little different. So please reach out to us.
And I just sent you a message from Dr. Johnny Johnson, president of the Mile High Medical Society. He says, great presentation, workshop, and he's wondering if this is something you can give to his group.
Oh, I would love to. So, absolutely. Just my contact information, send me an email, and we can set up a time to chat to figure out how to really make it tailored to your folks, and if necessary, if it needs to be tailored, and when we can set it up. I'm totally open to that.
I just put your email address in the chat for everybody to see.
Oh, you did? Thank
Yes,
you.
and I'm going to put your phone number too.
Thank you.
I mean, they're there, but we can always do it more than once.
Okay.
Okay, so your phone number is there for all to see, I believe, and your email address.
Sounds like a plan. Thank you. Yes. So what's next?
Dr. Terry Richardson says she will be calling you.
Dr. Richardson, thank you. I would love to hear from you. Thank you. Anything else? We're ending early, right?
Yes. The next session starts at 3. So this would give people, if they wanted to, time to go back to the home website and look at other things and check over your presentations and stuff. I don't see it in the group chat. Let's see what's going on here. Let's do this again. I'm going to resend your information. Here is your phone number. Here's your email address.
Mm-hmm.
And here is your phone number. Let me know, people, if you're coming through or not. Okay. So hopefully everybody sees your email address and your phone number.
Okay.
They got it.
Thank you. So,
You are welcome.
yeah, everybody enjoy the conference. I know I am. Yesterday was great, and today started off good too. So I'm psyched to go see and hear some more people speak. So thank you.
Thank
you.
you.